Somaliland's healthcare system was utterly destroyed after the long civil war. A large sum of deaths and immigrants were the country's trained healthcare professionals. The health of the people in Somaliland is the worst in the world. In 1997, before the split of Somalia, it had one of the highest maternal and child mortality rates. The statistics were shocking. There were 1,600 maternal deaths for every 100,000 live births, whereas in the United States, there are roughly 10 maternal deaths for every 100,000 live births. There has not been any more recent and valid data that has been published, although the rates have worsened since the destruction of the country. A Somaliland woman, Edna Adan, had a lifelong dream to build a hospital to help the women of Somaliland while giving birth. Her mission is to improve maternal and infant health care and fight the practice of female genitalia mutilation. Edna Adan was born and raised in Somaliland into a wealthy family and was well educated. At age 15, a girls' school opened in Somaliland, and she went to work as a student teacher there, as well as holding private lessons. Adan was the first Somali girl awarded to go and study in Britain. She spent 7 years there, studying nursing, midwifery, and hospital management. After coming back to Somaliland, she became the first qualified nurse midwife in Somaliland. Also, she was the first Somali woman to drive a car. Adan married the Somaliland Prime Minister, Muhammad Haji Ibrahim Igal, but divorced years later. Adan was recruited by the World Health Association and worked for many years in various positions. She advocated for the abortion of harmful traditional practices. Edna Adan had a lifelong dream to build a hospital and help the women of Somaliland. She sold all of her possessions, including her Mercedes, in order to raise money to fundraise for her dream. As the building was going up, the money ran out, yet the hospital was not completely built. Adan asked for donations and made it her mission to live out her dream. A foundation started called Friends of Edna's Hospital, which raised an abundance amount of money to help Adan, and they were able to put the finishing touches on the hospital. The Edna Adan University Hospital is located in Hargeisa, Somaliland. The hospital is a non-profit charity hospital which addresses the grave health problems that endanger the lives of women and children in the Horn of Africa. As of March 2002, the hospital started its operations. The hospital began with 25 maternity beds, but has since grown to accommodate 69 patients and newborns. There is a fully trained staff, including nurses and laboratory technicians. The achievements of the hospital is incredible. Edna and her team have reduced the mortality rate from 1,600 to 406.2 deaths for every 100,000 live births. If you would like to continue to help Edna Adan in her mission, you can donate directly to her website, or you can even go and visit the hospital and volunteer. For more information about Edna Adan and her mission, go to her website.